Many seniors have hip problems. As we age, our bodies undergo various changes, and one of the most common issues faced by the elderly is hip pain. This discomfort can stem from a variety of causes, including arthritis, fractures, or simply the wear and tear of daily life. As we get older, our bones can wear down. The cartilage that cushions our joints can deteriorate, leading to painful bone-on-bone contact. This degeneration can significantly impact mobility and quality of life, making even simple tasks feel like monumental challenges. This can make it hard to walk and do everyday things. Activities that were once second nature, like climbing stairs, getting out of a chair, or even taking a short walk, can become daunting and painful. The loss of independence can be frustrating and disheartening. A hip replacement can help you feel better. This surgical procedure involves replacing the damaged hip joint with a prosthetic one, which can alleviate pain and restore function. Many patients report significant improvements in their ability to move and perform daily activities post-surgery, but it's important to understand the surgery before you decide to have it. Hip replacement is a major operation, and like any surgery, it comes with risks and benefits. It's crucial to have a thorough discussion with your healthcare provider to weigh these factors carefully. This guide will tell you what you need to know. From the initial consultation to the recovery process, we'll cover all the essential information. Understanding the procedure, the potential outcomes, and the recovery timeline can help you make an informed decision. We'll talk about the good and the bad. The benefits of hip replacement can be life-changing, but it's also important to be aware of the potential complications and the commitment required for rehabilitation. Knowing both sides of the story will help you prepare mentally and physically, will help you understand what to expect. From pre-surgery preparations to post-surgery care, having a clear picture of the journey ahead can alleviate anxiety and set realistic expectations. You'll learn about the steps involved, the support you'll need, and the milestones to look forward to. Knowing what's ahead can make you feel more prepared. Being well-informed can empower you to take an active role in your healthcare journey. With the right knowledge and support, you can approach hip replacement surgery with confidence and optimism, ready to reclaim your mobility and improve your quality of life. Hip replacement is a big surgery. It is often recommended for people who have severe arthritis or significant damage to their hip joint. This procedure can greatly improve your quality of life by reducing pain and increasing mobility. The doctor will give you medicine so you won't feel anything. This is called anesthesia, and it ensures that you are comfortable and pain-free during the operation. There are different types of anesthesia, and your doctor will decide which is best for you. They will take out the old, worn-out part of your hip joint. This involves removing the damaged cartilage and bone from the hip socket and the top of the thigh bone. The surgeon will carefully prepare the area to make sure the new implant fits perfectly. Then they will put in a new hip made of metal and plastic. The new hip joint is designed to mimic the natural movement of your hip. The metal parts are usually made of titanium or stainless steel, and the plastic parts are made of a durable material that can withstand the forces of walking and other activities. This new hip will help you move more easily. After the surgery, you will work with a physical therapist to regain strength and mobility in your hip. Physical therapy is a crucial part of the recovery process and will help you get back to your normal activities. You'll be able to walk and stand with less pain. Many patients find that they can return to activities they enjoyed before their hip problems began, such as walking, swimming, and even light jogging. Most people feel much better after they recover from surgery. Recovery times can vary, but most people start to see significant improvements within a few weeks. With proper care and rehabilitation, your new hip can last for many years, allowing you to enjoy a more active and pain-free life. Every surgery has some risks. This is true for hip replacement too. Older adults might have a higher chance of problems. These problems can happen during or after the surgery. Some risks are infection, bleeding, and blood clots. The doctor will talk to you about these risks. It's important to ask questions if you don't understand something. After surgery, you'll need to be careful. There are things that could go wrong as you heal. One risk is a hip dislocation. This is when the new hip joint comes apart. You'll also need to watch for signs of infection. These signs include fever, redness, or swelling around the wound. Tell your doctor right away if you notice any problems. Getting back on your feet. Rehab after a new hip. You'll need to do exercises after surgery. This is called rehabilitation or rehab. Rehab helps you get stronger and regain movement in your hip. A physical therapist will teach you special exercises. They will show you how to move safely. Rehab takes time and effort, but it's important to do your exercises so you can recover well. When you have other health problems, if you have other health problems, tell your doctor. Things like diabetes or heart disease can make surgery riskier. These conditions can also make it harder to recover. Your doctor will create a plan that's safe for you. They might give you special instructions to follow. Your feelings matter. Dealing with emotions. Having surgery can be scary. It's normal to feel anxious or worried. Talk to your loved ones about how you're feeling. You can also talk to your doctor or a counselor. They can offer support and answer your questions. Taking care of your mental health is just as important as taking care of your physical health. How long will my new hip last? Most hip replacements last for many years. The new hip can wear down over time, just like your natural joint did. If your hip replacement wears out, you might need another surgery, but with proper care, your new hip can last for 15 years or more. Support makes a difference. Family and home. Family is the cornerstone of our lives, providing us with love, care, and support, especially during challenging times. When a senior family member undergoes surgery, the role of the family becomes even more crucial. Having support after surgery is important. It can significantly impact the recovery process, making it smoother and less stressful. The presence of loved ones can provide not only physical assistance, but also emotional comfort, which is vital for healing. Family and friends can help you in many ways. They can assist with daily tasks that might be challenging during the recovery period, such as cooking, cleaning, and running errands. This support allows the recovering individual to focus on healing without the added stress of managing household chores. They can drive you to appointments, ensuring that you never miss a crucial follow-up with your healthcare provider. Regular medical check-ups are essential to monitor your progress and address any concerns promptly. Help you around the house and offer emotional support. Emotional well-being is just as important as physical health. Having someone to talk to, share your feelings with, and receive encouragement from can make a significant difference in your recovery journey. Make sure your home is safe before you return from the hospital. Remove tripping hazards such as loose rugs, electrical cords, and clutter that could cause falls. A safe environment is crucial to prevent any accidents that could hinder your recovery. And install grab bars in the bathroom. These modifications can provide additional support and stability, reducing the risk of falls. Consider other home modifications like installing handrails on stairs, improving lighting, and rearranging furniture to create clear pathways. Having a safe and supportive environment will make your recovery smoother. A well-prepared home combined with the love and care of your family creates an ideal setting for healing. Remember, recovery is a journey, and having a strong support system can make all the difference. Embrace the help and cherish the moments spent with your loved ones during this time.